Hi, Mamas!
Hi, Pop-Ups!
Yes, welcome back. And well, we're still in Korea. We're doing a lot of series about oral hygiene.
Yep.
And today we will be discussing certain tips on how to properly use so that you'll be able to do toothbrushing, do the rinsing, and all this oral hygiene to increase the chances of not going to the dentist anymore.
So the idea is
yes,
for you not to go to the dentist
yes,
very frequently.
Yes, so we will be giving you 5 tips,
5 tips
for the day on how to do it properly. So here we go.
What's the number 1 tip, Doc?
Yes.
She's the dentist, so she should know.
Yeah, okay, yes.
Yeah.
I will teach you how to do it. You know, even if you're a dentist, you're also human. So sometimes you do it the wrong way. So, you know, a lot of toothbrushes has come out in the market. You know, there's the motorized one, and then there's the one that is manual. Okay. So, of course, like any other hygiene, it's really important that you brush your teeth.
Talaga?
Yes, 3 times.
Kailangan ba talagang mag-brush ng teeth?
Yes, at least 3
How many
times
times
a
a
day.
day?
At least 3 times a day, or
3
every
times a
time
day.
you eat. You know, like breakfast, lunch, and dinner.
Okay.
Now, but if you're too lazy, I guess you really have to brush your teeth before you go to sleep because.
So once a day is okay?
No. Okay, I will lose my license if I will say yes. Okay, so in brushing, a lot of people think that the first thing is you have to choose the right brush. Yes, it is true, but the most important thing in brushing your teeth is not really the type of toothbrush that you use, although it helps. But the most important thing is how you brush your teeth.
So whether it's manual brush,
yeah, it doesn't matter.
Whether it's
motorized
brush,
yes,
or the one with the charcoal,
yes,
or silver,
or whatever it is,
it's okay.
the brushing, the toothbrush is not really a critical factor, but what is critical is how long you brush your teeth,
Okay.
how you brush your teeth.
How you brush your
Yes,
teeth.
how you brush your teeth.
So paano yun? Ibig sabihin kung paano mo, kung gaano katagal or gaano...
Yes, because you know, the reason why there is a motorized toothbrush is because it already helps you in the way it cleans your teeth.
Okay.
Yeah, so this is for tamad.
Pero mahal.
Tamad. Yes.
Mahal siya.
But actually, if you're really this is actually ideal for men.
Why for men?
Yes, because men has a tendency to really not brush their teeth properly because as you know, like skincare, you cannot relate. Non-compliance, yes. So it helps a lot, and even for children, you know, if you have the motorized, it makes them like makes brushing teeth fun. And then you're not too lazy.
Yeah, I think men will like it because this is like a gadget for you.
Yeah.
Right? So it's just, lagay mo lang sa teeth mo, bahala na siyang...
Yes. But still, even with the motorized, you need to place, you have to use the tip of, the very tip of your toothbrush. Okay? So that's the one. So, and okay, you need to do it at a 45-degree angle. So if you're brushing your teeth like that, and then you go like this, and this toothbrush, which is by the way, we would like to thank Aquapick for their special location for us.
Yeah, this is their office.
Yes, this is their office, and we're in Seoul.
Ganda, no?
Yes, social tayo ngayon. Yes, social. So again, when you brush, the tip of your toothbrush, it goes at 45-degree angle. So if you're brushing on the upper part, so you go down, because you don't want to do like this, or you don't want to do like that, because what it hurts is your gums.
So you go for up and down motion?
No, just down.
Up, down motion?
No, in the up part, go down.
Okay.
In the low part, go up.
Okay,
Yes.
so down,
and then up, yes. And then that's in a 45 angle, and you're using just the tip of the brush. That's why your bristle, once it becomes sharp, at least three months, you have to replace it.
Okay.
Because brushing also affects it, and like the force. This is what's good about motorized, because you know, you don't put too much force. Because if you're doing manual, some people, like me when I was young,
I do that.
yes, you think that by pressing it hard, it will make your teeth cleaner.
Yes.
But what it does, it hurts more of your gums. So, what is very important, whether you use a motorized toothbrush or you use a manual brush, is that the bristle has to be good. Like some bristles that are rounded, it shouldn't be painful on the gums. That's why you need to replace it after 3 months if it becomes sharp. And then you brush it in the upper teeth going down, on the lower teeth going up. And another thing is you have to brush the one at the back. See, like this one. See? Because sometimes a lot of they just brush in the front, but they don't brush at the back.
So pati yung back part.
Yes, likuran. And even in the molars, you go like that. See?
Okay.
So that's why if the bristles is like a little bit small in the length, it's easier. Because if it's too long, sometimes it's very hard to push it at the back.
I see.
Yeah. So now whether it is soft, hard, I recommend at least soft to medium bristle for brushing, because again, you do not want to hurt your gums.
Okay.
Yeah.
So brushing the teeth is as important as taking care of it.
Yes. And honestly, the entire thing, you can, well, supposedly, ideally, per quadrant, when you divide, you divide the face into 4. You know, so upper right, upper left, lower right.
So may quadrants.
Yes, lower left. Supposedly 5 minutes per quadrant, but that's too long.
That's
See?
20 minutes.
Yes,
on.
yes, for brushing. So as a compromise, you can actually really brush it for the entire 5 minutes for everything. But we have a tip, because while we were interviewing, please watch our interview with the owner of Aquapick when we were discussing Aquapick versus manual flossing.
Yeah.
Now, during our interview with him, he introduced us with a very nice...
Oh, yeah.
Yes, the second part is doing mouthwash, applying mouthwash after, the brushing and the flossing.
Yeah.
And the good thing about this, it will really become effective if you place it on the foam, on the mouth, and then you brush it. Because Jack and I, when we saw, especially Jack, they tested his teeth, and then they swab it. And
so naglagay sila ng some material to get a saliva from my teeth or from my mouth. So tapos inilagay nila sa microscope. Of course, hindi ko ina-expect na parang may gubat dun sa
ng bacteria.
microscope. And yung kanyang case, brush case, ayun ang gamitin after. So you will see all
of
video.
These things. Yes. And when Kevin informed us about this, that you can actually add it into some of the items to make it, like for example, if you're too lazy, then you can place it here, and then, because the reason why you're trying to brush a longer period of time is basically you want to remove all the debris in your tooth, especially in between the teeth check. Kasi pagka sa middle kasi medyo mahirap eh. So that's why you wanted to scrub it longer, and then of course to kill the bacteria.
Okay.
But again, sometimes you don't get all the bacteria away. So if you're too lazy, you just pump this and then brush it, so it's all in the same time. And then you wash it with with an oral irrigator.
Don't wash it, don't spray it.
Yeah. So it's very interesting. But first, you don't really, I'm not telling you to buy all this gadget, but what I'm telling you is that brushing is very important. So you need to at least brush for 5 minutes, go 45-degree angle, and then brush it. If it's the upper teeth, go down. If it's the lower teeth, go up. Okay, and then you have to use the floss.
So that's number 1.
That's number of brushing. And then the second one, we discussed about the mouthwash. That's why I informed the the cleaning foam. Okay, so in the mouthwash there are different kinds of mouthwashes. Okay, there's a cosmetic mouthwash, there's medicated mouthwash, and this is the natural mouthwash.
Natural ingredients.
Natural ingredients. And then, I think it has green tea.
Oh,
yeah,
wow.
yes.
The flavor is green tea.
Yeah, green tea. So it really tastes very good. It's not like medical, and it's not that drying.
Yeah, that's why when I tried a lot of mouthwash before, ayoko rin mag-mouthwash kasi mostly it's drying.
Yes, it's
yung
drying.
lasa niya, it's either too spicy
Yes.
or yeah, the flavor is too sharp. But this one, para ka talagang refreshing yung, para ka nag-candy actually.
Yes, because in the mouthwash before they put alcohol on it.
So it's alcohol-based.
Yes, alcohol-based. And then sometimes they also address, there are some contents like chlorhexidine that also help in the killing of the bacteria.
Okay.
So normally the steps is you brush your teeth, you floss, and then you do the mouthwash. So that's and then you're not supposed to drink any more water, especially in the evening.
Okay.
Yeah, after at least 30 minutes to 1 hour. Or you just go to sleep so that you're not introducing a new bacteria in your mouth. Yeah, so that is the interesting part. So as I said, you do the mouthwash, and this one we are really very surprised, right? So it's really exciting.
Watch the video.
Yes.
You'll see how effective this particular product is.
Yes. And if you like this video and you learn a lot from it and how you keep your oral hygiene, please don't forget to give us a thumbs up and hit the notification bell, and do give comments below on any questions you have for me in regards to, or for Jack about his experience, or if you have any tips also on how to do proper oral hygiene, please comment below. Yeah, and we would like to hear from you. But anyway, we go back to the mouthwash. So there are different kinds of mouthwash, but I honestly don't recommend those that contains alcohol anymore, because these are really dehydrating materials. Also, when it comes to medicated mouthwash like chlorhexidine, it is very good, but you cannot use it more than 7 days.
Oh yeah.
Yes, because chlorhexidine is very good, but the tendency it causes a stain.
Kung nagtitiis whitening ka, tapos nag-mouthwash ka ng chlorhexidine.
Yes. It's
purpose.
good for 7 days. It's like certain medicine. It has a specific time frame where you can use it to get the benefits. Pero after a while, you just
so
really have
if a product like this is available in the market,
yes,
use the natural product
yes.
and alcohol-free, water-based or natural.
It's not painful.
Yeah.
And then we will show you, as you can see in the video, the microscopic effect.
And one more pala, this is like yung mga pop-ups, very familiar sila. Like when you use cream when you're shaving, kaya they developed the foaming technology. This one I think is the first one.
Yeah.
First mouthwash na nakita ko na may foaming technology.
Yeah.
So it's so easy. You don't have to do the gargling and things.
Yeah. And you don't even have to rinse it because it's safe.
Yeah.
You just have to spit the excess.
That's it.
Yeah, and then you can use it once a day. Yeah, so it's very exciting. So after rinsing, you also do the floss. Now, Jack, can you hold the different floss?
Okay.
Now, again, there is different kinds to remove the debris in between the teeth. You can do the floss, you can do the oral irrigator, and of course, the well-known toothpick, and then the interdental brush. Okay, so there's a lot of stuff to clean in between the teeth. Now, of course, the most common is the flossing. So when you're doing the floss, so what you do is like what Jack, no, there's no space. What Jack does is you show it to them. No, how you, that one. You put it on the index finger, and then you follow the V, inverted V on the upper, and the same on the lower. So you just follow the groove of your gums.
Okay.
Not sometimes the patient, they put up and then down. That's too painful. And then it damaged the V section
Kaya minsan
of the head.
dumudugo rin siya.
Yes, kasi isisingit mong ganyan, pasok mo, labas mo. Ganon.
Okay.
Diba? So, mali yun. So, ipa-follow nyo yung group nung gums. Ayan.
This one, pag pinasok mo siya,
Ayan.
di ba? May
Pa-follow mo then.
groove.
Yes.
Okay.
Yun.
Okay.
So, that's one. Now, honestly, I'm not such a believer of toothpick. But,
Why?
Yeah,
But
because
that's the most
sometimes,
convenient way of-
yes, and it's the cheapest one as well.
Cheapest one.
But the problem is sometimes they poke it too much and it damages the gums. So
Sometimes I see a twig, a branch of twig in a tree, or
yeah,
palito. Pwede.
yeah.
Okay na yun.
Ang kuripot mo talaga, Diyos ko, Day. Hello? So, anyway, ayan. So, there is another one that actually you can get this from a dentist and it's very convenient. You just push it and then it's safe. It's like a very thin saw, opal picks. Yeah. So, this is but again, it comes with the price. So, but if you like the toothpick, fine. But please be very careful with your gums. So, first you brush properly at the right angulation and time. The second one is that if you use the floss, do it properly also. Because if you have to change the location every time you change when you floss, because once the dirt is on the floss and then you transfer it on another thing, so you're just transferring the dirt from one area to another. Yeah. Oo, ito yan. Yan. So, of course, after the floss, then you do the mouthwash.
Okay.
And then, the mouthwash. And then, of course, the fourth one is eating the right kind of food, you know. So, like, for example, yogurt, apple, because these are all, apple, because it's very fibrous. So when you bite the apple, it's like you're already brushing your teeth.
Oh,
yeah. Because there's a lot of fruits that has vitamin A, and then also protein. Also? Yes, pineapple not so much because it's very acidic.
So apple is the best example. What else?
Well, carrots are good because it's vitamin A. For peanuts, like almonds.
Gummy bears.
Yeah. So that's the thing you have to avoid.
Why?
High in sugar, because this can cause a lot of caries incidents.
It's rubbery and it cleans your teeth, right?
I love gummy bears and it's really tasty to eat, but this all causes caries. So try to avoid high sugar content, and it's not also good to in your waist, di ba? Parang ganon. Okay. So what is the fifth one? If you want to have the detailed tips, please go to dmt.center, and I will place the link below. So I finished the toothbrush. I'm sorry because we came to Korea just yesterday, right? So the toothbrush, your mouth rinse, your flossing, and then your food. And then what's the fifth one? Oh, the lifestyle. Thank you very much. Because sometimes you're floating already, the lifestyle. Of course, it's very important. Like, for example, you shouldn't be smoking. And then...
hindi ako tinatamaan.
Yan. Oo, ako aray-aray. Ayun. So, and then, of course, you have to eat healthy as well.
Diet is also very important.
Yes. And of course, like for example, if you have other bad habits, like you grind at night.
But sometimes you cannot avoid because when you're sleeping,
but there's a way to have a treatment on that, because sometimes patients, they don't want to visit their dentist and then they don't want to fix it.
How do you treat that?
You can actually use a mouth guard.
So parang parang nagbo-boxing ka, gano'n.
Yeah. Because ang nangyayari kasi pag nagna-night grind ka, bukod sa hindi makatulog yung asawa mo o girlfriend mo, ang nangyayari, ina-abrade niya yung ngipin mo. So, have protection. And of course, another part...
Ang hirap mo naman matulog na may mouth guard.
Initially, yes. But later on, like, look at you, you're wearing a splint, then after a while, it doesn't matter anymore.
So bagay, when I was first wearing the splint, so it took me a while to adjust. First week.
Yeah.
But on the second week, medyo okay na.
Yeah. So, as you can see, as I've said, you create a certain habit or lifestyle so that your teeth will be healthy, not only your teeth, your gums. And of course, the most important part in lifestyle is at least visiting your dentist once or twice a year. Not because you have a problem, but because it's necessary for them to check if everything is okay. Because, prevention is worth a pound of cure. Am I saying it right?
Ano sa Tagalog yun?
Yeah. Okay, so mas magandang nagpre-prevent kayo, di ba? So, we will write in the description below where you can find the much detailed tips on how to take care and have a good oral hygiene so you don't have to spend so much money on your dentist for treatments. More on prevention. Yes. So again, if you like this video, please don't forget to give us a thumbs up. And then I would really appreciate it if you can also go in the comment below for whatever topics you'll be interested to see it.
Yeah, yung magiging ginipig na naman.
Yes. But before we say goodbye, we would really like to thank Mr. Kevin Lee.
Thanks, Kevin.
Yes, and all the people in Aquapick who was very, very generous and made us use their facility and provided us, at least a lot of material to give some information for you.
Yeah.
Yes, about taking care of your oral health.
This is all for you.
Yes.
So make sure to drop us a comment below.
Yes,
Alright?
yes. Okay. So, kamsahamnida.
Kamsahamnida.
Bye-bye.